Hello and welcome to Inside Healthcare. October is National Breast Cancer Awareness Month, and thanks to screenings, early detection, and advanced treatments, there are millions of women who are now breast cancer survivors. In 2021, Minnesota Senator Amy Klobuchar became one of the thousands who are diagnosed when she was diagnosed with early-stage breast cancer after a routine mammogram. Senator Amy Klobuchar tells us how she is doing today and her message to women everywhere. Right. Well, thank you, Senator, for joining us on Inside Healthcare.
Of course.
We're really excited to have you with us. So we wanted to know, right, how you're doing since your breast cancer diagnosis and treatment and that. How are you doing today?
Doing really well. I had, of course, a low-level stage 1A and caught it fairly early, although I'd waited too long to have the mammogram during the pandemic. Now they say my chances of getting cancer again, I just got a lumpectomy and I got radiation, but my chances of getting cancer again are like the average person. I don't know who that average person is, but I try to imagine. So I feel really good about that, but I really, from going through this experiencing and realizing that I had waited on the mammogram, I realized that there were so many people out there that hadn't had theirs. And so when I went public with what happened to me, I had literally hundreds and hundreds of tweets and texts and letters to our office and emails that people had gone in as a result, including a few that found out they had cancer and are in good shape now. And it's just a realization that prevention matters and getting the word out matters.
Yeah, you mentioned the experience and you wrote about it in your book. And why is that important for you to share that with the public and with everyone about it and also write about it? Yeah.
I think that sometimes people are so busy in their lives, they have families, they've got jobs, and they just kind of put stuff off. And in my case, during the pandemic, I was probably safer to go to a doctor's office than the grocery store, but I still went to the grocery store. So in my mind, I thought, well, I'll do that later. And then, I found out that I had this stage 1A cancer. And I think that getting the word out and making people realize that it can happen to anyone and that you've got to go in there and get tested, I think it's really important and that's why we have, Breast Cancer Awareness Month in October. That's why you see NFL players with their pink shoelaces or flight attendants in pink sweaters. It's a reminder to go and get your checkup. And especially now, since we passed the Affordable Care Act for, people of a certain age that it's free, that's a real advantage. And so that before it was really costly for some people to go out and get a checkup, and we wanted to make sure that we didn't have that as a barrier. So people should just go in and get checked out and then follow the advice of your doctor. It's the mortality rates have gone down so much since people started with prevention, but also since we got better treatments. And a diagnosis, as I can attest to, doesn't mean that you're going to have a mastectomy. Now, a lot of people do. It's the right thing to do for them, or their cancer is more serious. But there's just more ways to more quickly go on with your lives if you get the diagnosis sooner.
I think that's really important for people to be aware of that. And maybe not all women are aware of that they can get screened and things like that it is available. So that's wonderful.
Exactly. And one of the things that I'm doing with Senator Susan Collins is that we have a bill together to get more focus out there about the screenings and the preventative care and those kinds of things, because the two things I kind of learned was there's that, and then there's the after it's done thing. which is for a lot of women, especially younger women, they may have had a mastectomy, they may have had extensive radiation, and then all of a sudden they're on their own. And so that's why we also have a bipartisan bill called the Comprehensive Cancer Survivor Act, which helps survivors, especially younger ones, tackle all of the challenges that come their way. And, it's everything from hormone issues to all the things that we know if people have mastectomies that come with that, and some of the risks after that. There is something besides just getting diagnosed and getting the right treatment. It's that you're in a good place afterward, which also helps your health.
What great advice for our viewers. Final message for our viewers during this Breast Cancer Awareness Month. And
Well, for me, it was just a gift how everyone helped me. And I know that they will, they different ways. People have different people that help them, but the nurses and the doctors and the nurses' aides. I did have a little different experience than some people because maybe I'm a U.S. Senator. As I was ready to go into the surgery, they take your phone away. I'm laying there on this gurney with this target on me with this robe on. A constituent recognized me and still felt okay in coming to talk to me about their issues, and came to talk to me about Burma. And there's some serious issues going on there. And I still remember as I was going under, and you're supposed to be all Zen-like and count sheep, I was just saying to myself, don't forget Burma, don't forget Burma. And when I woke up, I said to my husband, was it a lumpectomy or mastectomy? He goes, a lumpectomy. And I go, great. And I go, could I get my phone? I have to call someone about Burma. So that was unique. But except for that, I had a lot of the same experience. And one of those things is not just the healthcare providers that are there that you realize, but just your friends and your family, and my husband getting up early to take me to radiation. You really start to appreciate the people around you, and that every day is a gift.
well, it's a gift and it's a privilege to have you on Inside Healthcare. So thank you for your time. I know you're very, very busy. So thank you very much.
Right. Thank you
Thank
very
you so
much,
much.
Jody.
Thank
right.
you.
See you. Bye.
Bye.
Meet America's adults over 65. 70% of them have high blood pressure, and nearly 50% of those don't have it under control. Even with Medicare Part D coverage, about 5 million adults aren't taking their blood pressure medicines as directed. So why does that matter? Because high blood pressure is one of the leading causes of heart disease, stroke, kidney disease, and death in the United States. Along with healthy food choices and regular physical activity, blood pressure medicines reduce those risks, but only if prescriptions are filled in the first place. And 1 in 4 adults with Medicare Part D skip doses or stop taking their medicines altogether. Some are reluctant to treat a problem that often doesn't have symptoms. Others get confused over when to take which pills, or worry about cost or unwanted side effects. The thing is, heart disease, stroke, and kidney disease don't care about those factors, but you can take action. Ask questions about how to correctly take your medicine and why you need it. Keep track of your blood pressure between medical appointments with a home monitor. Coordinate pill refills for fewer trips to the pharmacy, and reduce confusion by using weekly pill boxes and tracking apps. It's easy to download free tip sheets and tools to help you or your loved ones take their blood pressure medicines on time and in the right amount. To learn more, visit millionhearts.hhs.gov.
Well, welcome back to Inside Healthcare. Infertility is more common than most people think. Health officials report that 1 in 8 couples are affected by infertility in the United States. Well, we learned of a Minnesota mom of 3 who is passionate about surrogacy and how she has helped 2 different families by carrying their babies. And we are so pleased to have her with us here in the studio to share her fascinating story. And we're glad to have with you Josie Dolliger. So thank you for being with us.
Yeah, thanks for having me. I appreciate it.
Before we talk about your passion as a surrogate mom, just tell us a little bit about you and your family. I mentioned that you're a mom, you and your husband, a mom of 3.
Yes, we have 3 beautiful teenagers. One's off to college and 2 in high school. They're very active. Our daughter was a swimmer in college. She didn't swim this year just because she's going to be wrapping up in December and the season extends beyond just this semester. And then our boys are both 3-sport athletes, so yeah.
And you're also a marathon runner yourself?
I am, yes, yeah. And
a professional?
Yes, yeah, and dental hygienist, so yes.
Yeah, I mean, that's in of itself, it's it's more than a full-time job, what you do and stuff. And then also I had the pleasure of meeting you and your family, beautiful family, and that you had said when you were in college, you had your first baby, your daughter, and that within days of her birth, you had a medical emergency.
We did, yes. So my husband was in the military, and so we had gone. It was family day. They were preparing to go to Iraq, and it was family day, so we went up to Camp Ripley to visit for the day, and we got back late that evening. I went to go change her diaper, and she wasn't breathing. She just had like foam coming from her mouth and her nose. So I immediately, thankfully, I was staying at my parents' house because she was just 12 days old. And so my mom was able to call 911. My dad and I started CPR immediately. The first responder actually ended up winning a life-saving award.
Absolutely.
Yep. So yeah, we were all pretty traumatized. We didn't really know, there was really no explanation. They figured it was probably SIDS that we had caught, just because there was just no explanation of what happened. We ran her through a whole bunch of tests. She continued to have some episodes, minor episodes, nothing like that first one, but she's fine, she's healthy, she's in college.
You gotta be so proud of her too.
Yes, yeah, but very stressful. I mean, I suffered from PTSD from the whole ordeal, but recovered.
I was gonna ask, how did that impact you and your family?
Yeah, I mean,
going through that.
I had a lot of hours of therapy, so yes. And my husband didn't go to Iraq. He was probably just too much of a liability to take, and so it was early in the war, and they decided to have him stay home.
Wow.
Yeah.
And you're passionate. You have a passion as a surrogate mom. Tell us about that passion.
Yes. So when I was pregnant with our third child, we knew we were going to be done. He was going to complete our family, but I just didn't have the sensation that I was going to be done having babies, but we didn't want any more of our own. And so surrogacy was something that just felt like such a win-win. I could help other people, and I could be pregnant and give birth. I love childbirth. If I could give birth for a living, that's what I would do. But it takes 9 months of gestation. So anyway, it was just a great way to, enjoy the pregnancy again and childbirth.
Enjoy the pregnancy.
Yes.
When and why? I mean, what was the timing on all of that? You're saying you're done with your children, but why at that point, and when was that?
Yes.
And why?
So I was pregnant with our youngest. He was born in 2008. And that's when I talked to my husband, and we decided that surrogacy would probably be a great option. However, we were living in California at the time, and we just wanted to get settled back in Minnesota. And so the feeling, I would kind of suppress the feeling, and then it would come up with like a vengeance. Like I don't know if you believe in callings, but it was something I just knew I needed to do. And so finally, after about 6 years of talking about it, my husband said, maybe you should stop talking about it and just do it. And so I signed on with an agency here in Minnesota in Maple Grove.
So how do you go about doing that once you have an agency and then decide this is the time? And
yes, there's a huge screening process. I mean, you have to qualify to be a surrogate. And then you go through some psychological evaluations to make sure that you would be a good person to carry. And then you go through a matching process. And the agency was so wonderful. You know, I just said, I don't want to be matched with the top couple. I want to be matched with the perfect couple. And so they just said, they kind of went through, I had like a few top things that I really wanted to carry for a local couple. That was kind of my top requirement or, decision. And so they matched us with a local Minnesota couple, and I also wanted to stay in contact with them. I didn't know what that might look like, but The couple also wanted to stay in contact. And so, yes, I feel like they couldn't have given us a more perfect match.
So it's as easy as you make it sound,
Yes.
but obviously with infertility, with other couples, you struggle to try to get pregnant. Was it as easy as it sounds? I mean,
So for some people, it is as easy as it sounds. I carried 3 babies. You go through IVF. You take their embryo and you put it into my uterus, and I, gestate the baby, and the baby goes home. And so for us, it was that easy. Each time, it took the first time. Now, it's not like that all the time. I think I might be rare. A lot of people go through multiple transfers in order to get a successful pregnancy and healthy baby. So,
and tell us about with the first, tell us
Yes.
about these little babies.
right, the first time, it's so new. It's brand new for all of us, and I think from the surrogate side, we're so excited to get to know this couple, and I dreamed about, I dreamed about them being this family, and so yeah, it's just a lot of getting to know each other. It's a brand new friendship, and we're fortunate because we all got along. The couple, my husband and I, it's almost like we've been friends forever. So.
And did you have a scheduled C-section, or was it just natural delivery?
Natural delivery, yep.
Wow.
One of the sisters of the intended parents is a midwife. And so, during our first initial phone call, they were like, we would love for her to be involved. And I just love childbirth so much. I mean, from the time I had our first daughter, after I had her, it was just my husband and I thought everybody should witness childbirth. And
Absolutely.
so I was like, the more the merrier, everybody should come in. And so, so the aunt of the baby came, and she was with me all day, putting me in different positions. I never had a midwife before. I always delivered with an OBGYN, and all of the sudden she gave me this.
So natural.
Yes, it was amazing because she put me in all of these different positions to get the baby to engage, and so she was with me, came to my house, was with me basically through the whole delivery. And then I said, I think when we kind of knew I was going to carry their second baby. I said, I'm gonna come and see you. So she actually became my provider for the second baby.
Oh.
And then the third baby. So she was at all the deliveries.
Wow.
Yeah.
And just tell us a little bit about the babies.
Yes. So the first baby was born in 2014. They had a little baby boy, and I got very sick with him. The medications, I lost a lot of weight, and so they were a little concerned I might not carry their second baby because I got so sick with him. I became so sensitive to sweets. So even a banana was just like too sweet.
Wow.
Yeah, it was very bizarre. And so yeah, he's now 9, and his sister is 7, and yeah, they live in
And I think
Woodbury.
the last one was just a year and a half ago, or 2
Yeah,
years?
she's going to be 2 next month.
Wow.
So yeah, hard to believe that time went quickly. So yeah, sweet family. So
What was that internally for you? I mean, the emotion and everything to go through something like that. I mean, I loved when I was pregnant with my children too. I mean, never felt more alive, and I just can't imagine what it must have been like for you.
yes, I mean, I think that's the one thing that the biggest concern people have is how could you do that? The emotional part. And because I just knew it was something I was meant to do. I was very clear with my extended family. We sent out a very well thought out email of just kind of setting boundaries of, this is what we've decided to do. I feel so passionate about it, and if you have any concerns or anything negative, please keep that to yourself. We only welcome positivity around surrogacy, and so they did just that. I feel so fortunate, and the people that maybe didn't agree with it in my family, they just didn't say anything. And so it was just very beautiful to be a part of. And so many of my family members afterwards said, gosh, if this was available so many years ago, some of my aunts said, I would have done this.
I know. I hear what you're saying.
Yeah.
I know that my older sister was never ever able to have children too, so I totally understand what you're saying.
Yeah.
So, and you have remained, you feel like you're lucky that you've remained close to these families, to these kids?
I'm so fortunate. I think it's very rare what we have. I think that we've maintained such a close relationship, but that's because I think we've all desired it. The first two babies, I was asked to be their godmother. And so I haven't missed a birthday party, very special occasions. The cool thing is when I thought about surrogacy, I imagined this couple, I imagined this baby, but I didn't imagine the extended family. We've gained a whole family.
Oh.
I mean, one of the grandpas of the babies said, Josie, you're just a part of our family. Our kids are a part of it. There's just so much love. The parents of the babies said that they can't have too many people to love their children, which I think is just beautiful. They just care so much about these kids, and they're so wanted.
I love it how that you literally gave the gift of life to these two families, and how you feel like you got a gift in return.
Absolutely, yeah.
That gift that just keeps giving then.
Right, and it will forever, generations to come. Their family trees have been changed, and it's just so beautiful. Yeah.
What would you say to anyone else that's listening about this, the being a surrogate mom, about that whole process, and what would you say to them?
Yes, I'm an open book, and so I feel like when people have questions, I feel like I always want to give them honest, candid answers because I'm so passionate about it, and people who have watched, it's very interesting. After I've had each baby, people have been inspired to carry. So a coworker who I worked with during my first pregnancy has gone on to have 2 surrogate babies. Oh. And then when I carried my second, we were up in the St. Cloud area, and so she's carried 2 surrogate babies. And then we moved down to the Twin Cities when I was pregnant with a second. I also have another coworker who just had her second surrogate baby.
Wow.
Yes.
How inspiring.
Yes.
Yeah.
And then I recently had a friend who I actually worked with in California who said, I'm going to do this. And so she's working on becoming a surrogate too, now that I've had the third. So it's really fun that it's just inspired. I mean, look at all these other families whose lives have been changed just by the gift of, surrogacy and inspiration. So
amazing, just amazing. I love the story. As a news reporter, I had the opportunity to witness other births as well and stuff, so absolutely loved. Thank you so much for sharing your story,
yes.
Josie. Yeah.
Thank you for having me. It's such an honor. I appreciate
really
it.
A pleasure to have you with us, so thank you so much.
Yeah.
Coming up, we talk with a local doctor about ways to prevent asthma during this fall, so stay with us, everyone.
Meet the scan, a simple procedure whose mission is to detect lung cancer early.
I'm here to save you!
But I feel fine.
That's great, but you may still be at high risk for lung cancer.
Oh man, that's a new fence.
If you smoke, early detection could save your life. Learn more at savedbythescan.org.
Finally, with our unusually warm October days and poor air quality, doctors are seeing increased cases of asthma-related injuries. Here is Dr. Christy Trussell with the urgency room.
Asthma is a chronic lung inflammatory condition. The inflammation causes the airways to narrow, and there's some difficulty and results in some difficulties breathing. So this can manifest as wheezing or as cough. There are many different asthma triggers for patients, so it's a pretty individualized uh, kind of constellation of symptoms. Exercise certainly can trigger asthma symptoms, and this can be chest tightness, cough, wheezing. Exercise-induced asthma tends to be on the milder end of the spectrum of asthma symptoms, and that most patients with just exercise-induced asthma have symptoms, again, just with exercise. And that's usually treated with an inhaler, such as an albuterol inhaler, that helps open those airways and allow for more comfortable and safe exercise.
When should you be taking the medication and things like that? Before you even have asthma?
So that really depends
Symptoms?
on the patient. Asthma is a chronic condition that needs to be followed very closely along with your primary care doctor, and they'll get to know your symptom pattern and then your exercise and asthma needs. Some patients do take the medication before. Some patients take their medications just as needed when symptoms arise. And that's a really individualized decision based on your symptom pattern and the severity of your asthma.
And I know there's different causes for it, but I know, we've been seeing a lot of health alerts, in particular because of smoke and from Canadian fires and wildfires and that. How are those affecting people, whether they've known that they have asthma or not?
Yes, well, the smoke from the wildfires certainly can be irritating to anyone with or without asthma. For patients with underlying asthma, it certainly can be a trigger to exacerbate their underlying asthma symptoms. Many patients do feel worse when there's that smoggy, smoky air. There are many triggers for patients. So, any cold or illness can trigger asthma symptoms. Fall allergies, as we go into the fall season, can certainly trigger asthma symptoms. The smoke, as you mentioned, and even the combination of those things can really kind of put patients who had previously been well controlled in a spot where they're really feeling a lot more tightness and wheezing.
And when should they come see you, a physician over at the urgency room?
Yes, we take care of a lot of patients with asthma. Anytime that you're having a significant worsening of your asthma symptoms that's not responding well to your usual home treatments, many patients have what's called asthma action plan from their primary care doctor. And so if you're home, if you're feeling like your breathing is worsening despite the medicines that you have at home, certainly if you're having bad wheezing, trouble breathing, or symptoms of new infection, we should do an assessment of your oxygen, how well you're moving air through your lungs, and decide if you need an increase in your asthma medicines or even a new medicine over the short term, like a steroid, to help with lung inflammation.
Yeah, really good advice. And it can be so scary, I think, especially for a parent and their child having that. So any advice that you'd have on maybe ways that they can prevent it as well, having asthma?
So yes, as I mentioned, asthma is a chronic medical condition, and having good follow-up over time with your regular doctor to have an asthma action plan is really important. To have your inhalers available at home when things start to worsen, to follow your rescue plan. At the urgency room, we'd be happy to assess any shortness of breath, and we see lots of patients for asthma. Sometimes we do also find other causes for difficulty breathing. So difficulty breathing is certainly a reason to come see us at the urgency room.
That is our show for you. Thanks for joining us. Join us again next time on Inside Healthcare. We'll see you then, everyone.